Neurotransmitters are the brain's chemical messengers which take information from one part of the brain to another. Dopamine and noradrenaline are examples of these, and it's thought that in people with ADHD, they have different levels. So they may have lower than expected levels of dopamine, and the brain tissues might have a varying response to noradrenaline. Dopamine is in charge of executive functions. It has an important role to play in thinking, planning, strategy, learning, and emotions. Noradrenaline is important for maintaining focus and concentration. At the time of menopause and throughout the female menstrual cycle, we also have the complicating factor of estrogen. Estrogen is found throughout the brain tissue, and it's very important for supporting the effect of dopamine and noradrenaline. It's well established that at the time of menopause, many women will say they have differences in their cognition, so they may not feel able to focus in the way they did before, perhaps they're forgetting things, and commonly I will hear this described as brain fog. In fact, even throughout the menstrual cycle, some women notice that at ovulation, which is a time of high estrogen, then they have better brain days and they have increased amount of energy and focus. After ovulation, when there are lower levels of estrogen, they notice this can become more difficult for them. In the menopause, we know that initially after wild fluctuations of estrogen will fall so low that periods stop altogether. And at this time, the support that estrogen is giving to dopamine and noradrenaline will fall. There are some women at the time of menopause who say to me, I think I've got ADHD. They identify with symptoms that perhaps other people they know have experienced. Maybe they've got a family member who's recently had a diagnosis and they wonder if they might have a diagnosis of ADHD too. There are some women who've managed really well premenopausally. They've developed strategies to help them stay on track, to help them stay focused. And this has meant that any ADHD tendency has gone unrecognised. But at the time of menopause, with the low levels of estrogen, this has become unmasked, and suddenly things feel very much more difficult. In terms of what to do, the first thing I would suggest is that we try and optimise your menopause management. It's important not to forget the role of lifestyle, because eating well, moving, stress management, and sometimes psychological therapy can be very beneficial. An advantage of HRT is that it can help restore estrogen levels back to premenopausal levels, and this can help greatly with some women's concentration and cognition, as well as their other menopausal symptoms. If, however, despite optimizing HRT or other non-hormonal management for menopause, if HRT is not suitable for you, if you still feel like you're struggling, it may be worth seeing somebody with expertise or a specialist interest in ADHD to discuss what else can help. Medications for ADHD can be life-changing for some people, and they feel that things are much more manageable for them.